My name is Bridget Donovan, and for this differential case presentation, I looked at the case of patient 3, who is a 40-year-old woman. She has a history of breast cancer, who was successfully treated with tamoxifen for several months. Otherwise, she's healthy, no other issues at this time. She is a successful businesswoman in a high-profile career with much stress. She is married to her wife for 4 years. The relationship is rocky at times. She denies any substance use and she travels frequently. Her presenting signs and symptoms were shortness of breath, chest pain, flank pain, and fever. Some high-risk criteria that I looked at from her case study was her history of breast cancer is one. She may be immunocompromised from this, and it also might put her at an increased risk of developing blood clots. She was also treated with a course of tamoxifen. Tamoxifen is a non-steroidal anti-estrogen, and it's used to treat breast cancer. Although the risks associated with it are minimal, there are some adverse reactions. Most of them are along the lines of the anti-estrogen activity, including hot flashes, nausea and vomiting, vaginal bleeding, or any menstrual changes in premenopausal patients. Also, although not common, thromboembolic events may be reported. This patient also has a high-pressure job and rocky relationship at times, which increase her chances of high-stress situations. She also travels frequently. Long flights may predispose her to blood clots, and also she may be in contact with many people who put her at risk of exposing her to infection. My first differential diagnosis was a pulmonary embolism. My reasons for this was that she travels frequently. She could be on long flights often, which increase her risk of developing blood clots. And a DVT could then lead to a pulmonary embolism. She also has a history of cancer. The breast cancer could increase her risk of developing a blood clot as well. And then, although not common, the tamoxifen has a known association between thromboembolic events. Her symptoms, pulmonary embolisms can present with transient or crushing chest pain, depending on the severity of them. As the pulmonary embolism is consuming a lot of the lung tissue, she could feel short of breath. Hemoptysis or fever is common with pulmonary embolisms, maybe just low grade, but and then decreased cardiac output, depending on how prolonged this goes without treatment, could limit blood flow to the kidneys, which may lead to some flank pain. To diagnose, there would be an X-ray, a lung scan, an MRI, pulmonary angiography, either one or all, depending on what they find. Lab work could also be performed to determine an elevated D-dimer, which might also be prior to any diagnostic testing. My second differential diagnosis was the flu virus. This is because of her history of cancer. She could be potentially immunocompromised. She travels frequently, so either if it's an airport or train station, no matter what, it might increase her chance of exposure to the virus. Fever would be a common symptom, as influenza is an infection. It is typically marked by an acute onset of fever. Body aches are typical with the flu, which could be interpreted as flank pain. Also, she could be dehydrated, which could also cause flank pain. Shortness of breath. Influenza is an infection of the upper respiratory tract, which could lead to feeling shortness of breath. And chest pain could be related to the tightness from the chest, the shortness of breath, making it difficult for her to breathe. A diagnostic test is just a typical flu swab. As influenza is a virus, there's not much treatment for it. But if caught early enough, she could be treated with some antivirals. If not, it'll just go away eventually. Hopefully no complications such as a pneumonia, but to be monitored closely. And then my third differential diagnosis would be a myocardial infarction. Women experience MI may present with atypical symptoms. Typically, Myocardial infarctions are assumed to present with crushing chest pain, radiating to the neck or the left arm, or shortness of breath. Women might present somewhat differently, making diagnosis somewhat difficult. The reason for this was, again, her frequent travel, which could increase her risk of blood clots, and that could lead to a blockage in one of her arteries. Also, rocky relationship and high-pressure job increases her stress, which could predispose someone to a myocardial infarction. Symptoms: sudden severe chest pain are common with a myocardial infarction. The pain could radiate or just remain right on the left side of her chest. Low-grade fever can develop, especially as MI worsens. Shortness of breath can present as there's lack of oxygen, possibly to her lungs. And then due to lack of cardiac output, there could be some flank pain due to no blood flow to the kidneys. An EKG is typically used to diagnose and monitor, as well as serum blood work exams to check for electrolytes and cardiac enzyme markers such as troponin and CPK. My original differentials that I came up with just out of the blue was a DVT-PE, just because of her travel frequency and her history of cancer. I also thought maybe an MI just because of her increased stress and her risk of blood clots, and the symptoms seemed to line up with both of these two. The lung cancer was kind of just because of her history of cancer. Recurrence can sometimes be common, but I realize now, looking back, that was probably unlikely due to her successful treatment. But the first two seem to line up with kind of what I figured from the research I did. And the references I used are listed here. Thank you.